During this time of uncertainty, and as we prepare to open our doors to our patients, we wanted to shed some light on the changes and new policies that we have put in place. The purpose is to keep all of our patients, staff, and our families as safe as possible while providing much-needed dental care. In creating these new guidelines, we strive to adhere to the American Dental Association's interim guidance for minimizing risk of COVID-19 transmission. These guidelines include the following. All patients will be screened for any respiratory symptoms, fever, recent exposure to COVID-19, or recent travel. Patients will be scheduled one at a time during the day in order to minimize any interactions between patients. Patients will be asked not to bring a companion if possible, and to wear a mask as they enter and exit the office. Alani Dental has acquired all recommended personal protective equipment and will be used for all procedures. These include N95 respirators, face shields, disposable gowns, and gloves. High-speed suction and dental dams will be used during any procedure that produces aerosols. We will also implement new procedures when checking patients in and out for appointments. These include the following. We ask that you arrive 10 to 15 minutes before your appointment time. Call the office number to notify us of your arrival. Any paperwork that needs to be completed prior to your appointment will be done verbally. Wait in your car for a call asking you to enter the office. This will occur once the previous patient has left and the office has been disinfected thoroughly. Please put on your mask and come into the office, and you will be escorted directly into the treatment room. If you do not have your own mask, one will be provided to you. At the end of your appointment, you will be informed of any payment you owe for the services rendered. You will be escorted out of the office and asked to call to make a payment over the phone. We apologize for any inconvenience as we are unable to accept any cash payments at this time. A receipt will be mailed or emailed to you for your records. We also plan to keep our staff to a minimum to reduce any possible exposure for both our staff and patients. As we continue to monitor the developments of this pandemic, we will make decisions on expanding services and increasing both staff and patients. These decisions will not be made by a specific date, but rather by scientific data. We hope that these new policies and procedures give our patients the peace of mind and reassurance that we are taking every precaution and have thoughtfully made changes to ensure their safety during their visit. We hope to see you all soon.